Hi, my name's Kristen, and I am doing my full body assessment for my final. My patient is my husband, Paul. I'm going to start by doing his blood pressure, which I would use an adult cuff. Paul, do you have any blood pressure problems? So what I'm going to do is pump up the blood pressure cuff until I can no longer feel his pulse, and then I will go 30 mercury meters above. Just rest your arm here. No longer feel it at 140, so I will go to 170. Paul, your blood pressure was a little bit high at 162 over 92. He does have a known history of high blood pressure. Thank you for letting me do that. The next thing I want to do is inspect his skin, his color, temperature, and turgor. He is Italian, so his skin is a little bit on the darker side. Temperature is cool, dry. I'll check his skin turgor. He has great recoil. I'm next going to inspect his hair and palpitate your scalp. Is that okay? Okay. So he has very thick hair. His scalp I don't feel any lesions. Do you have any pain? Okay. And then I just want to look at your face. Everything looks symmetrical. Do you have any pain? Any tenderness? No. Okay. I want to check his peripheral fissures, which I just need you to scrunch your eyes for me. Good, they're even. And I need to look at your nasolabial folds. If you could just smile for me. Perfect, and those are even as well. So the next thing I want to do is I'm going to check your jaw muscles and check your movement on your jaw. Do you mind if I do this? Okay, thank you. Any pain in here? No. Can you open your jaw for me? Can you put your jaw forward on your bottom? Great. Side to side. Smile. Any pain during that? Okay, perfect. So he has full range of motion on his jaw with +5 strength. I'm now going to evaluate cranial nerves 8 and 12. And by this, I need you to wrinkle your forehead for me. Good. Puff out your cheeks. Stick out your tongue. Perfect. And your cranial nerves are intact. And that was actually cranial nerve 7 and 12. So now I'm going to look at your corneas. If you could take off your glasses for me. And by this, I'm just going to come to the side. If you could just look straight ahead and open your eyes wide for me. Perfect. And I would do this on my whole assessment on both sides, but for the final, I'm just going to do everything on one side. So I'm also going to look at your irises. Irises are brown, clear. And now, Paul, I'm going to check your accommodation in your pupils. finger to your nose. If you can look straight ahead. Perfect. The pupils are direct with consensual dilation. Okay, and now I'm going to test your peripheral vision. You're going to mirror me, and when I'm going to come in with my fingers, and you tell me when you can see them.
Yep. Yep. Good. Good. Good.
Perfect peripheral vision. Thank you, Paul. And now I'm going to check for your eye movement, and if you can just follow me, your eyes with my finger. Perfect. So, great extraocular eye movement, perfect cardinal fields of gaze. And now I would don gloves at this point. If you could remove your glasses for me, I'm going to check your lacrymal ducts, which are the inside of your eyes. I'm not going to actually touch you, but what I would do is check the lacrymal ducts for discharge, tenderness. Any tenderness up here? Perfect. And if you could actually pull down your eyelid, then I can check your conjunctiva. Good, nice pink. It looks well. There's no nystagmus. And now I'm gonna do your ear. We're gonna move to your ear, is that okay? So I'm gonna look at the auricle of your ear, which is just the outside of your ear. No pain. And this is your tragus. I'm just going to touch that. No pain?
Nope.
Perfect. And do you mind if I look in your ear?
No.
If at any point I've hurt you, please let me know. I'm going to pull his ear back and up. And I see a pearly white ear canal with no redness. The eardrum is clear and a little bit of wax. Your ears look lovely. Thank you. I also want to do a whisper test. We're going to check your hearing. So what I'm going to do is I'm going to have you turn your head this way. I'm going to cover my mouth, and I need you to repeat the 3 words that I tell you, okay?
Ear, ball, cat.
And that was correct. Your hearing is perfect. And I would again do this on both sides. Next, we're going to do the Weber test. Now, I don't have the correct tuning fork. I know I should have a 512. I have a neurological tuning fork that I will use, which will do about the same, just different sensation. So I do know that I should have the correct tuning fork. So Paul, what I'm going to do is I'm going to put this on the top of your head to check your vibrations. And I need to know if you hear it in your left, your right, or both ears. Are you okay with this?
Yeah.
Okay.
Both.
Perfect. The next thing we're going to do is check your bone conductivity and your ear conductivity. So I'm going to use this again. I'm going to put a little bit of vibration, put it on the back of your ear. I want you to tell me when you can't feel it anymore. Then I'm going to move it to the front, and I want you to tell me when you cannot hear it anymore. You okay with that?
Yep.
Okay. Ready?
Okay. Okay.
And that was perfect. It was 9 to 18. It needs to be a 2-to-1 ratio. So that was perfect. Ear conduction is always better than bone conduction. So the other thing I want to do now is we're going to check your nose. It looks like your nose is midline. No, everything is equal. Do you have any pain in your nose? Okay. So the next thing I want to do, if you don't mind, is look up your nose. I won't go in it, I'll just look up.
Okay.
Okay. And I see a little bit of hair. Nose is midline, no discharge, no redness, and you feel fine?
Yep.
Perfect. And now what I want to do is check your sinuses. Do you have any tenderness?
No.
Do you mind if I tap?
That's fine.
This is your frontal sinuses. Little tap. Any pain?
Nope.
Can you remove your glasses for me? And I'm just going to tap right here.
Okay.
Perfect. So he has no pain on his frontal or maxillary sinuses, which is normal. I'm next going to look in your mouth and your throat. Are you okay with that?
Yep.
Okay, perfect. If his lips are perfect color, lips are symmetrical, could you open your mouth for me? I'm just going to grab a light, I'm sorry. Hard palate looks pink, no lesions. Soft palate is also pink with no lesions. No dental caries. Do you see a dentist on a regular basis?
Yes.
And can you stick out your tongue for me? Perfect. And I just want to look at your uvula, which should be midline, and your tonsils. Open up real big. Tonsils are present and intact, and uvula is midline. No redness, no soreness.
Nope.
Perfect. The other thing I would do at this point is don gloves, grab a 2x2 or 4x4 on the tongue and move side to side to look for any lesions or any sores. I'm not going to do that at this point, just to let you know. Thank you. Okay, I'm just going to hit start.